expect me to say. And I shall, sorry, can everybody hear me? And I'd like to thank the Imperial team for the discussion we had last week. It was very useful, and I think we're all on the same page in terms of our drive to be patient-centric and reduce some of the quite shocking health inequalities that we have in this borough. Moving on to some of the specifics, I'm concerned about the timing of the announcement. I think you mentioned that last week. I think, as was once infamously said by who was a Labour Transport Secretary, Special Advisor, it's a good time for bad news. I think a lot of people are away in July and August, so I think the communications are going to go amiss a little bit. Having said that, just looking at the nature of the communications brings me to what I think is the most serious point. I'm very worried about paediatric services and the impact this is going to have, because I think it is entirely misleading for you to say, to be honest, that adults and children can go there for, and you've got, you know, some things there, but then you talk about infections. Now, infections to members of the general public, I mean, that could be scarlet fever, meningitis. You know, a lot of GPs don't pick that up. That's why we get so many serious cases. You do not have specially trained paediatricians in this urgent care centre. And I did hear Susan saying that they've been on an updated course. And I did take the liberty of calling some people that I know, some of the leading lights in the Royal College of Paediatrics and Child Healthcare, who had a screaming fit, frankly, when I mentioned that to them. And they referred me back to the Wolf report, which I'm sure some of you will be familiar with, which says in London alone, one child dies unnecessarily every day compared to the best health networks in Europe, which are the Scandinavian networks. And that's because children, like we talked about adults, are not pushed through to secondary and tertiary care quickly enough. I am gravely worried that you are seeing children in this centre without paediatric cover. And I hear what you say about adults, and you have crash teams and you have experts available, and that's fine. But certainly to the best of my knowledge, there are no fully staffed, trained, consultant-led paediatric wards or staff at the Hammersmith. Queen Charlotte's is separate, and I understand that's, you know, for very, very small children, they'll be taken there anyway. But if a gravely sick child turns up, according to this definition, because trust me, as a parent, it's difficult when you're making that assessment to know where you take the child. So I want to know, really, because I think, to be honest, it is unsafe to say that. And I think the CQC and Mike Richards would agree with me, unless you've got some really good answers to that. The second point is, I think, you know, this is a great kind of piece of advertisement for an internal organisation. It is not a patient-centric document, because you have the issue where you're going to spread this all over the place. You do not talk about the specialist paediatric accident and emergency units where people are supposed to take or present with seriously ill children. And not all seriously ill children, trust me, present in ambulances. Many parents will put the child in the back of the car and rush them to the hospital. That's one of the reasons why I fell out with our friend Mr Livingston, who refused to reimburse people on the congestion charge going to the Chelsea and Westminster. It's a fundamental principle for me that people, if they have a gravely ill child, have the right to rush that child as quickly as they possibly can to the appropriate medical facility. There are two medical facilities in this part of London that are qualified and should see those children. One is St Mary's and one is the Chelsea and Westminster. And nowhere is this referenced in here. And I think that's got that, to be honest, you're doing a disservice to the specialist paediatricians and the children of our